we are going to look at the amino acid derivatives. So first, to ask of few questions. The first question is, what are the derivatives of the tryptophan? And next one is, what is the derivative of glycine? Then arginine. So in this video, we'll ensure that you know the answers to all these questions, and at the end of the video, there are some bonus questions as well. Now to start with, first we look at the tryptophan. So what is the tryptophan? It can lead to the niacin. Leads to niacin. So this niacin can also contribute to the NAD plus as well as the NADP plus. Then the tryptophan, it also leads to the serotonin. So this serotonin can lead to the melatonin. So next we look at the histidine. So what is the histidine? So histidine, you have a presence of B6. So under this, there comes the formation of the carnosin. There is presence of the carnosin. There is also the histamine and the anserine. Then we move on to the glycine. So what is the glycine? So glycine, it leads to the porphyrin. So glycine leads to porphyrin as well as the presence of, it leads to heme. Then what we do is we look at the glutamate. So what is the glutamate? So under glutamate, it leads to the GABA as well as there is the glutathione. And then we also have the arginine. So in case of arginine, it can lead to the creatine, leads to the urea as well as the nitric oxide. Then we also look at one interesting, that is, how is phenylalanine being converted to the epinephrine. Phenylalanine to the epinephrine is what we are going to see. So first, the phenylalanine. So this phenylalanine in presence of the BH4. So in presence of BH4 is converted to the tyrosine. So let's expand it like this so it's easier to finish it. So in case of tyrosine, this can lead to the thyroxine as well. Let it be on one side. Now in presence of BH4, it breaks down to the dopa. It leads to dopa, and this dopa can also lead to the melanin. And then what we see is this dopa in presence of B6. The dopa in presence of B6 can lead to the dopamine. So now this dopamine in presence of vitamin C. So dopamine in presence of the vitamin C, it leads to norepinephrine. And here in presence of SAM. So in presence of SAM, it leads to the epinephrine. So this is how phenylalanine is converted to the epinephrine. Now we'll find out the answers to our questions. So the first question we dealt was, what is the derivatives, that is in case of tryptophan? So this tryptophan is converted to the niacin as well as the serotonin. So this niacin, it can also lead to the NAD plus as well as the NADP plus. What about the serotonin? Serotonin can lead to the melatonin. Next question was, what about glycine? So the glycine is converted to the porphyrin. Glycine is converted to porphyrin as well as heme. This is all by glycine. Then the third one was, what about arginine? So the arginine, it is converted to the, there is creatinine, there is also urea, as well as there is the nitric oxide. Now we are going to go to the bonus questions. So these bonus questions, you can answer it in the comments. So the first question we want to do is, first question we would like you to answer is, what are the histidine? What are the derivatives of histidine? The second question is, what are the derivatives of the glutamate? So the third one is, tell the steps involved in case of the phenylalanine to the finally the epinephrine. So what are the steps involved? So you can answer these questions in the comments.